Well, Mr. President, if you hate women that much, you can keep the darn money. I'm Scott Ott, and this is Bill Whittle Now. And Bill, we did a show about this a few weeks back when a couple of state and local organizations were saying this to the Trump administration, and now Planned Parenthood, on a national basis, has said we will not accept Title X funding from the federal government as long as the Trump administration's new tightened rules say that we can't refer women to abortion providers. There's more nuance to it than this, but right off the bat, Bill, I remember when we talked about it the first time that both of us kind of marveled how Donald Trump has been able to accomplish some progress in the opposite direction when it comes to the issue of life compared to the steady slope of trajectory that has been since Roe versus Wade. What do you think of this new breaking news?
This is the third rail of American politics, and the reason it's the third rail of American politics is because it puts together, or rather sets against each other, two fundamental issues, and one of them is the ability to be left alone to do what you want to on your own, and the other one is a protection of life and a respect and just general sort of concern about human life. And the issue is divided along a very, very simple line. The question is an unborn child a person, yes or no? And if the answer is yes, then it's murder. And if the answer is no, then it's a choice you make with your body, and that's that. I do know that people who are on the side of the no, that's a person kind of thing, are really, really bothered by the idea that their tax money would be going towards paying for this kind of thing. To some degree, we're all complicit in what our government does. We all pay taxes. It goes into a general fund. If you don't like the Defense Department, doesn't matter. You're still paying for it, and there's that kind of separation. But on this particular case, I think it was such a moral imperative for so many people and bothered them so much that the idea that Planned Parenthood won't be taking federal money is it's not the remedy that they were looking for, but it's certainly, I would imagine, a pretty big relief in terms of their personal conscience.
Now, I want to clarify on a particular issue here, because true, Planned Parenthood is not going to accept some $60 million out of the $286 million in Title X funding that comes out of the federal government each year. They will continue to accept some $500 million in Medicare or Medicaid funding, rather, for the poor. The Title X funds are specifically designated to provide services like birth control, pregnancy tests, screenings for STDs, breast and cervical cancer. And Planned Parenthood has served something like 1.5 million low-income women each year with these services. And according to the New York Times, anyway, in some rural communities, Planned Parenthood is the only provider of such services. But Bill, I find it's an interesting position to take, because the Trump administration did not say in this new rulemaking that you couldn't talk to women about abortion, that you couldn't counsel them on the matter of abortion. It just specifically said you can't refer them to an abortion provider. In fact, the rule actually allows Planned Parenthood and other agencies like them to provide a list of other healthcare providers from which they can get other services. They're just not allowed to tell them which ones are abortion providers. So it's, like I said, there's some subtlety to this, but essentially, Bill, does it not look like Planned Parenthood has said, look, if we can't tell a woman where to get an abortion, we don't want to screen her for cervical cancer or breast cancer?
I think that's pretty much it. And I think to the degree that that is the case, I think it indicates a pretty clear trajectory on where Planned Parenthood's actual agenda really is. I mean, if you're talking about an agency whose stated goal is to provide health care for women and for low-income women and so on, the refusal of $70 million of care would be anathema if that was your mission. If you were basically in the position that we are providing prenatal care and neonatal care and all the rest of it, and you found out that you were going to lose $70 million because of a rule change that didn't really affect your operation any, at least under the presumed rules and guidelines that you were supposed to be operating under. I don't know how an organization that's all about providing services to poor people for their health would back out of $70 million because they can't tell them where they can go to get the abortion. Now, on the other hand, if you were running an abortion mill, this kind of thing would make some kind of sense. So if it turns out that you're looking at this from a strictly financial point of view, and look, I'm not saying everybody's motivated by money, but I am saying that money constrains the options of everybody in the world. If you're willing to walk away from $70 million, that's telling me that on some level financially, this is the least bad case. Needless to say, they'd rather have their existing business model, including the $70 million. But if this organization is willing to walk away from $70 million because they don't want to be restricted in terms of providing direct access to the abortion providers, then that's telling me that they think that they will lose less money by turning down the federal $70 million, and that tells me a little bit about where their actual revenue comes from and certainly where their politics are.
Bill, it's interesting because the Department of Health and Human Services said very much what you just said there. It looks like Planned Parenthood is not willing to hold up their obligation as a grantee of the Title X program to be able to provide these healthcare services to women unless they're able to carry out their main mission, which is as an abortion provider. The new ruling actually doesn't prevent Planned Parenthood from continuing to run abortion clinics. It's just that those have to be at separate locations from where they provide healthcare services for low-income women, and they can't refer those women to their own abortion services, but they can talk about abortion. Again, this is another one of those kind of subtleties of it, Bill. It says while Title X providers are prohibited from referring for abortion as a method of family planning, referral for abortion because of an emergency medical situation is not prohibited. So the federal government under Trump is still saying you can provide a referral for an emergency medical procedure for abortion, just not using abortion as a method of family planning. Doesn't it seem, Bill, at some point that there may be enough Democrats who could come behind this and say, you know what, that makes a lot of sense. I mean, after all, we wanted to make it safe, legal, and rare.
Not a chance. Obviously, it's obviously a devil's advocate question. It's just not a chance. According to the Democratic Party, if you are not pro-abortion, you're not only not a Democrat, you're not a woman either. And we've heard them say this essentially verbatim. And so the idea that they would give up any ground on this at all is just plain fantasy. There's nothing about this that's going to rally Democrats behind it. They're going to use it to rally Democrats against the Trump administration for imposing these restrictions on it. I don't think there's any question about that, Scotty.
Well, as I mentioned earlier, Planned Parenthood's annual budget, I think the most recent one we saw was from 2017-2018, according to the New York Times, still contained a line item for at least $500 million in Medicaid funding from the federal government. So they're not getting cut off there. The $60 million that they are losing as a result of rejecting participation in the Title X program because of the new restrictions from the Trump administration, that's $60 million. They're hoping to make up some of that from the states. They believe that some of the states will provide some of the lost funding for that. And frankly, Bill, my guess is that they're going to get a surge in contributions because just like on the right, when the federal government starts to tighten the screws on guns, people surge into the NRA. On the left, the same thing happens with Planned Parenthood. Do you think this could be a whole self-defeating tactic on the part of President Trump and his administration?
You know, I don't think so, Scott. And the reason I don't think so is because there's an enormous difference between what progressives say and what they actually do. These are people who call for increased taxes across the board and then tell their accountant to take every deduction necessary. If they really thought increased taxes were a benefit to the country, they're certainly able to write a check larger than the one that the IRS is demanding of them. And given the number of billionaires, multiple billionaires, who are openly in support of Planned Parenthood, you would think that covering a $70 million gap would be a fairly quick lunch among 6 or 7 people, tops. But that would mean putting your money where your mouth is. And they don't often seem to be willing to do that. In a way, it's weird. It's almost like the inverse of the problem we have with conservatives. Conservatives aren't willing to put their mouth where their money is. That's the problem. It's very hard for conservatives to raise money for projects because conservative investors don't really see the social benefit of these things. Soros puts down $30 billion for social programs and things like Media Matters and all the rest, and he's getting his money's worth. But in this case, I think this is a perfect example, and I also think it's part of the reasoning behind the decision on Donald Trump's part. It is exactly, to me, the same as his offer to take to deport illegal aliens into sanctuary cities. He's calling them on their virtue signaling and making them live up to what they say. So when Donald Trump says, "Well, if you really want to consider yourself a sanctuary city, we'll take all of the criminals that we've rounded up, we'll just drop them in San Francisco." That's an outrage. So now what we're doing is we're looking at a situation where the Trump administration is saying American taxpayers shouldn't have to pay for this, and they're not going to. That's a $70 million deficit. It's a significant hit. And now is your opportunity, Planned Parenthood and everybody on the left of the political spectrum, to step up and make donations in order to make up the shortfall. I don't think that's going to happen.
Bill, in the past, I've been personally critical of conservatives for often staking out moralistic positions without thinking through the process. It seems almost ironic that we have a president who makes very few pretensions to moralistic positions, and when he does, generally looks a little silly in the process of doing it. And yet here, somehow his administration has figured out a process that appears to make what one might call the first substantive change in the direction of life that we've seen in generations. But it could all be overturned in the courtroom. The Planned Parenthood and others have sued the government. And in fact, a week or so ago, Planned Parenthood sent a letter to the Ninth Circuit Court of Appeals and asked them to delay implementation of the new Trump guidelines until these court cases could be decided. Bill, the Ninth Circuit Court of Appeals declined to issue the stay.
You know what they say about a stopped clock, right? Yes. And this is another benefit of having Donald Trump as president. If the Planned Parenthood organization decides to fight this in the courts, then they'll fight it to the top court. And I suspect this issue would be decided by Justices Gorsuch and Kavanaugh. So, as Barack Obama famously said, elections have consequences. There's just, I don't know, Scott, there's just so much to say about this. I think this is another example of the difference probably between liberals and conservative. One of the main differences that I've noticed about the temperaments of liberals and conservatives, I could probably sum up most succinctly by saying this. It seems to me that liberals would rather feel good about a policy that does actual harm than feel bad about a policy that does actual good. And this I think is a perfect example of that. Donald Trump is to many people, it looks like he's stumbling through this. And again, I'm not one of these people who believe that he's a master of four-dimensional chess, but I will say this. Donald Trump is connected to reality on a level that most politicians aren't or haven't been, and Donald Trump is also a product of this society. And where I'm going with this is that if you have a person who is willing to accept reality as it is and to take the moral atmosphere that you're born with as an American, you are going to end up making the right decisions most of the time because we've been so incredibly successful with both of these things.
The members of BillWhittle.com have made possible these conversations that we have here 5 times a week. In addition, we produce another show called Right Angle at BillWhittle.com that is also produced 5 times a week. Plus, there are 4 episodes of the Stratosphere Lounge each month, and we throw in an occasional episode of Bill Whittle's Firewall. Ladies and gentlemen, that comes out to something like 45 to 50 episodes a month of new programming, all made possible by the members at BillWhittle.com. If you'd like to foster these kinds of conversations, see more of them, and see them spread around the world, please become a member at BillWhittle.com by clicking that Become a Member link. For Bill Whittle, I'm Scott Ott. Thanks to the members for making it happen.